Thank you, Dr. Roberts. Waiting to see if there are questions for you here. Yeah, Dr. Bronstein, if you could come up also in case there's questions. Yes, go ahead.
I'm Michael Jacobson from Center for Science in the Public Interest, and I'd like to thank Dr. Roberts for his cogent review of the toxicology of caffeine. Dr. Roberts, I don't recall your citing any research on caffeine as it's used in energy drinks. In other words, can you describe studies that look at the interactions between caffeine and taurine, which seems to be a popular ingredient in energy drinks, and some of the other chemical and herbal ingredients in energy drinks?
I mean, that's a very good question, and one that there is obviously no data out there on combination toxicology of these various ingredients. Having said that, each of the ingredients that are currently present within energy drinks have undergone the GRAS determination process. So the system that I've just outlined to you here for caffeine has also been conducted for several of these other, or all of these other ingredients that go into energy drinks. And substances like guarana obviously is another natural form of caffeine, but the caffeine that's incorporated into these energy drinks is labeled on the side of the product, and it incorporates both caffeine that comes from guarana as well as the anhydrous form. Also, we've heard a couple of people mention taurine, but taurine occurs naturally in the diet, and taurine is a component of meat and poultry, seafood, and dairy products. It's also present in human breast milk, and it's actually added to some infant formulas, as well as occurring in cow's milk formulas. So the levels of taurine that occurs in energy drinks has been evaluated with this background exposure scenario taken into account. And again, experts have looked at this and considered the combinations to be safe.
Thank you. Before the next questioner comes up, I just wanted to clarify. One of your slides cited one of the papers by our group, and you mentioned that the data on toxicity with caffeine is only supported by case reports, and then you cited our paper, which had in there 3 years for the entire United States National Poison Database, specifically for caffeine. And in there, what we reported in that peer-reviewed paper was 10% had serious events requiring medical therapy, and there were deaths in each of the 3 years. But those were not case reports. Those were, that was across the United States. Just a correction. Next questioner, please.
Yes, my name is Rick Kingston, and I'm with the Safety Call International Poison Center at the University of Minnesota. My question is for Dr. Bronstein. Considering the focus of the workshop is really on energy drink exposures in children, when I looked at your conclusion slide, it seemed to me like it was a little bit misleading. You indicated that there were 18% of the cases that had no effect, which essentially implies that 82% are symptomatic. And when I looked at the material and going through the paper actually that was published in the last few weeks, if you look at the kids that are less than 12 years of age, it's actually reversed, especially when you include the not followed non-toxic and not followed no more than toxic, because when those calls are called into the Poison Center, we classify them based on the fact that there's no symptoms reported at the time that call is received. So if you add those together, it means that about 82% of the cases are asymptomatic in the pediatric population, and only about 18% show any symptoms, and the majority of those are minor in nature. So it seems like there should be a different take-home message here.
Thank you, Dr. Kingston. It's an excellent question. The cases that I showed in 6,200, those were not just pediatric exposures. Those were all ages. And it was simply, that was one piece of information that of those cases, there was 18% that had no effect. And the rest of the cases I showed on one of the slides had various medical outcomes. And so if I put the slide back up, I could go over with you the exact medical outcomes. That's probably the thing to do. But I think for this purposes, I can do it after the...
But I think that's the point, is that if the focus is pediatric exposures, it seems like putting that information up there would be helpful. So
I didn't... The only pediatric that I broke out were for the 2-year-olds. The rest were all ages.
Okay.
And the 18% applies to all ages.
Thank you,
But I just
Dr.
wanna-
Goldman.
Yeah, I just want to make a clarification in terms of what the last speaker said. The focus of this workshop is caffeine in food and dietary supplements, which certainly might include such drinks, but it is not simply, we're not simply focused on those drinks. We have a broader focus. I just want to make sure that's clear.
Thank you. Next questioner.
I'm Stephen Schaefer from the University of South Alabama. Actually, I've spent 30 years working on taurine. So my question to you is, why did you focus on taurine? Or why did you specifically mention taurine?
Is that to me?
Yeah.
Okay. Well, I specifically mentioned taurine was when I had a telephone call in, say, pre-planning with the committee. That was one of the questions the committee had. And so I simply showed that one particular product that contained the taurine as an example that we have that kind of information in the products database. I did not specifically look at the products that contained that amino acid to look at their clinical effects. Are there medical outcomes? My purpose was simply to state, if one wanted to look at those exposures to products that contain that amino acid, we can do it.
Okay, I mean, the reason I raise that is there's been some concern in the literature about possible interactions between taurine and caffeine. I'll be addressing that tomorrow. But in fact, taurine plays a very fundamental role in the cell. And all cells would be in trouble if they didn't have taurine, and I'll mention that tomorrow.
Well, thank you. And I was not intending to impugn taurine. I just wanted to simply say we have that information.
Next.
Jeff Goldberger from Northwestern University. Also, Dr. Bronstein, that's what you get for being here. As you look to refine your analyses of caffeine toxicities in the future, how important do you think it will be to incorporate information about habitual use versus non-habitual use of caffeine and actual caffeine levels?
That's also an excellent question. That's what I was attempting to get at with, we can refine the questions that what we call SPIs, the Specialists in Poison Information, ask. If we come to consensus on what that history taking should be and that data could be recorded, certainly that all could be done. The calls are taken to some degree like a physician talks to a patient, and for everybody does it a little bit differently. I do it differently from the next physician, et cetera. And so, but we can standardize that data set, and that's what I think what the signals from the poison centers are able to offer.
Thanks, Jeff. I mean, I think that'll come up further in our discussion sessions coming forward. The issue is chronic use versus acute use, habitual use, but also even in terms of acute versus long-term effects. And again, we'll get into that in more detail, but certainly in a poison control system, it's really acute events that are being captured. Next question.
Hi, my name is Dr. Michael Foreman. I'm a practicing board-certified emergency physician, so this topic is of great interest to me. There's been a lot of news in the press about the potential dire side effects of energy drinks, but myself, my colleagues, and in emergency medicine literature, we're really not seeing serious side effects from caffeine of any source other than intentional overdoses, which tends to be, of course, the over-the-counter pills. So my question to you is, since there's approximately 6 billion energy drinks sold yearly in the United States, and I believe your slide showed about an average of 2,000, maybe a little over calls a year, of which almost none of them have showed any serious side effects. Would you say with that denominator of 6 billion that that is pretty strong evidence that these are very safe products?
That also is an excellent question. With the level of the analysis that we did for this presentation and the time that I had, the data shows what the data shows. So let the data speak for itself. Whether or not that is the total picture, I think we need to do more study to really know what, if any, clinical effects we are seeing from these exposures. So right now I'll stand on what I presented, and as far as any blanket statement, I would like to do more study on this topic.
Well, thank you for the interesting question. I think in Dr. Roberts' presentation that was just given, he, anecdotal experience is important. It helps guide us in terms of hypothesis generation. I think within your field of emergency medicine this year, limitations, no limitations, all the data we're hearing have limitations. The U.S. National Dawn data came out, and that data had a slightly different conclusion, showing that emergency room visits related were considerably higher. But again, I think that'll be the topic of subsequent presentations. And so I'd like to move on to the next
Could I just
question.
respond to that? In terms of the Dawn data, I've looked at that data, and of course, half of those energy drink exposures of 20,000 are combinations of alcohol and other toxic ingestions. So that leaves about 10,000. And again, as a numerator, and those aren't even causative necessarily, but so as a numerator, again, over 6 billion energy drinks and over a denominator of 130 million ER visits, would you agree that also tends to support the fact that these instances of serious side effects are just, the evidence is not there?
No, again, I think that, a more formal assessment of this data would, before a group like this would be indicated. It was something we looked to try to do. We don't have it here. It'll be brought up in a number of presentations, and I think that interpretation, as we saw with the NHANES, the ILSI, the poison control, these are all ways that have limitations at assessing more large-scale data, and I think each one has strengths, each one has limitations, and all deserve discussion, in particular by people that are involved with assembling those. So I think, our personal interpretations are fine, but I think that we probably should leave it at that.
Thank you.
For this. Thank you. Next questioner.
Thank you. My name is Sergi Ferrer. I work at the National Institute on Drug Abuse. My name is Sergi Ferrer, and I work at the National Institute on Drug Abuse. Later on, I have the possibility to talk to you about mechanisms of action of caffeine at central nervous system effects. And it's about, I want to make a short comment about something that Dr. Roberts said, and it's about the metabolites of caffeine. And I want to draw your attention to some results we have, recent results, showing that paraxanthine, one of the metabolites of caffeine, has a very strong psychostimulant effect. I will try to show you some data. Why it's so important? Because he said that the rodents can be used to study metabolites, that they metabolize more or less the same way caffeine, but it's a little bit different. Their main metabolites, yes, they are theophylline, paraxanthine, and theobromine, but in human beings, paraxanthine is produced 10 times more. It's the main metabolite of caffeine. That's why I think that we should probably, I want to draw your attention to that fact.
Can I just respond to that point? While I agree that there may be differences from a quantitative perspective, given the fact that mice and rats have been dosed at levels probably 100-fold human levels, those actual levels of metabolites will probably be very similar to what humans are exposed to.
The question is how active this metabolite can be, which is something we're still studying. And that's the question I think we should address.
So as has been hinted at by the last questioner at the mic, we have presentations this afternoon that will take us into some other issues like cardiovascular system effects and central nervous system effects. I do have... So we are adjourning for lunch, and I've been told that downstairs here there's a a cafeteria that's been set up for participants to go and get lunch, or you can, of course, go off-site if you want to do that. In the back hall here for the speakers and the committee members, we have some lunch and an area if speakers are trying to prepare for you to prepare. We are adjourning for an hour, so I would like everybody to be back here at 1 p.m. if you can, and we'll look forward to seeing you. I think we'll have some very interesting discussions. Can I mention one more thing? There is a public comment period this afternoon. A number of people have signed up for it. I would very much appreciate if you plan to give public comments. We have kind of 2-minute slots, and we can have more comments if you want to give comments, but please let the staff know at this point in time to help us with scheduling this session. Thank you so much. We'll see you at 1 o'clock.